Today we're going to be talking about the downsides of Medicare Advantage plans. Yes, even those 5-star ones. Now please note, we are going to be speaking in general terms. There are of course people who love their Medicare Advantage plans, and we have clients who love their Medicare Advantage plans. But in the interest of full transparency, although we do have clients who utilize Medicare Advantage, most of our clients use Medicare supplement plans, and that's consistent with the vast majority of the country. But as always, the plan that you choose is determined by your needs, your budget, and of course the area in which you live. But before we dive in, a reminder, please make sure to click the subscribe button because we do release these videos on a weekly basis. And of course, make sure to give us a like, click that thumbs up so we can get this information out there. All right, let's dive in. So what are Medicare Advantage plans? Well, Medicare Advantage plans are sometimes referred to as managed care plans or Part C plans. They're actually an alternative to Original Medicare. So they replace Medicare Part A and Part B entirely. They're offered by private carriers, but they must offer at least the same benefits as Original Medicare. However, these plans are not standardized. And like I said, they're offered by private carriers and the benefits can vary widely. Many plans offer additional benefits not offered by Original Medicare, things like dental, vision, hearing, prescription drugs, and more. And very often these plans will boast that they are free. Now, are they free? Of course not. At the very least, you at least have to pay for Medicare Part B. And there are other interesting benefits to Medicare Advantage as well. For example, they will impose an out-of-pocket maximum, and that is not offered by Original Medicare. That's very important, and we'll get to it later in the video. Now, all of this may sound too good to be true, so you may find yourself wondering why people would reject a Medicare Advantage plan. First and foremost, let's talk about pre-authorization and referrals. They are slightly different, but they are tied together for the purposes of this video. So you may be familiar with the concept of a referral, especially if you've had an HMO in the past. Basically, if you need to see a specialist for any type of specialized care, for example, a cardiologist, a pulmonologist, an endocrinologist, etc., with a Medicare Advantage plan, you would need to receive a referral from your PCP. Now, why is this a bad thing? It's not necessarily a bad thing, but it definitely can be an inconvenient thing. You're going to need to schedule an additional appointment with your primary care physician, which is your PCP, and then that, of course, could lead to additional wait times, and that is not always ideal, especially when you need to get into your specialist now. Sometimes these additional wait times can just be inconvenient. Sometimes they can be extremely detrimental to your health when time is of the essence. And speaking of time being of the essence, pre-authorization can be a major headache with a Medicare Advantage plan. Now, let's say your doctor does provide you that referral or suggests that you get a certain procedure done. Well, that's not enough. You need your insurance plan to pre-authorize that service as well. And that can take a lengthy amount of time. And that can certainly be detrimental to your health, which is much more than just an inconvenience. In fact, there are many horror stories that you can look up of people waiting weeks or possibly even months on end for their pre-authorization to come through, or sometimes be denied. Now, this is not the case with Medigap plans, also known as Medicare supplement plans, which is one of the many reasons most of our clients choose the Medicare supplement route. Out-of-pocket expenses is another reason you may want to reject a Medicare Advantage plan. Now, many Medicare Advantage plans actually at face value seem to be a great cost-saving option. Many offer a $0 monthly premium. Again, it is not $0. You will still need to pay for Medicare Part B at the very least, but they offer additional benefits that aren't offered by Original Medicare plans or Medicare supplement plans. And of course, very often they have lower co-pays and they have that out-of-pocket maximum. So it's very easy to see why someone might be enticed. However, these plans can cost you in the long run. First, let's talk about that out-of-pocket maximum. Now, an out-of-pocket maximum is there to protect you from major medical bills. Basically, once you've hit that financial threshold, which is determined by your insurance plan and carrier, your insurance carrier would take on the remainder of the medical bills for a year. This is a very good thing, and again, it's designed to help prevent major medical bills. However, it resets on a yearly basis, and if you're somebody who's in need of continuous or long-term care, when your plan resets, you're going to have to meet that out-of-pocket maximum again. With a Medigap plan, this is not the case. You'll pay a larger monthly premium, but the vast majority of your healthcare costs will be entirely taken care of within that monthly premium. For example, let's say you chose Plan G, which is currently the most all-encompassing coverage offered to new Medicare enrollees. Well, you would pay an additional monthly premium in addition to your Part B. You would have to meet that Part B deductible, but beyond that, all of your medical care is basically covered. It wouldn't matter if you were hospitalized multiple times or if you had to see multiple specialists for multiple visits. There are no additional costs that you would need to be concerned about. And you also need to take into consideration that should you need to utilize an out-of-network doctor or an out-of-network hospital or specialist, then you would be on the hook for those bills. Now, of course, this is more specifically referring to HMO plans, but even with a PPO, the copays for something out-of-network can be a little bit more than what is financially comfortable. And finally, the third reason that I want to talk about in today's video is the network restrictions, which of course relates to travel restrictions. So if you do choose to go with a Medicare Advantage plan, you will have to operate within some type of network. And that can be rather restrictive. Many people have reported that they've had to travel significant distances to find a doctor or a specialist who accepts their plan. And of course, that is far from ideal. It's much more than inconvenient. It can again be detrimental to your health. And if we were to compare this to Medicare supplement plans, remember that even though Medicare supplement plans are offered by private carriers, it doesn't matter who your carrier is. If your doctor or hospital accepts original Medicare, they accept your supplement plan. And almost all doctors and hospitals accept original Medicare. And then there's also travel. Since we're talking about networks, it can be rather restrictive to have a Medicare Advantage plan if you plan on traveling. And that's one of the things that most people look forward to in their retirement, so it's really unfortunate to have that additional restriction added. If a Medicare Advantage plan is the route for you, remember that the annual enrollment is every year from October 15th to December 7th. During that time, you can join plans, switch plans, or drop a plan. And if this is the route that you choose, we highly recommend that you work with a broker. A broker will help you navigate some of those downsides that we've discussed in today's video and make sure that you're choosing the right plan for your needs. If you have any questions whatsoever, please feel free to send us a message. You can always reach us at the number on the screen, and of course, there is no charge for our services. And one last reminder, please do make sure to click subscribe, and of course, give us a like, click that thumbs up button so we can get this information out there. Thank you so much. Have a wonderful day. Bye-bye.